Could your blood pressure be quietly hurting you? High blood pressure is called the silent killer because many people feel fine while damage builds slowly inside their bodies. In this video, we'll walk through a relatable story, explain the science in simple terms, and give practical steps you can take today to protect your heart and life. Meet Maria, a 52-year-old teacher who thought she was healthy. She exercises sometimes, eats what she enjoys, and feels energetic most days. At a routine checkup, her nurse said, "Your blood pressure is higher than it should be." Maria was surprised. She had no symptoms. Her doctor explained that this was common and treatable but needed attention. Maria's story is common. Millions of people have high blood pressure without knowing it. Let's break down why that matters. Blood pressure measures the force of blood pushing against artery walls as the heart pumps. Two numbers are used: systolic pressure, the force when the heart beats, and diastolic pressure, the force when the heart rests between beats. For most adults, normal blood pressure is under 120/80 millimeters of mercury. Elevated levels begin above that, and hypertension starts at 130/80 according to modern guidelines. High pressure means the heart works harder and arteries are strained. Over time, this stress damages blood vessels, accelerates heart disease, and raises risks of stroke, kidney disease, and other problems. Why do some people develop high blood pressure? Often it's a mix of lifestyle and biology. Excess weight, inactivity, diets high in salt and processed foods, too much alcohol, and chronic stress raise risk. Genetics, age, and some medical conditions also play roles. For many people, the exact cause is a combination of factors rather than a single reason. The good news is blood pressure is manageable, and small changes add up. Let's zoom into the body to understand the physiology gently. Arteries are flexible tubes lined with cells that react to signals like hormones and nervous system messages. When arteries constrict, blood pressure rises. When they relax, pressure falls. The kidneys help regulate fluid balance and salt levels, which affect blood volume and pressure. The autonomic nervous system also adjusts heart rate and vessel tone. With hypertension, these systems are out of balance. Vessels may be stiffer, kidneys may retain too much salt, and stress responses may be overactive. Understanding this helps explain why lifestyle matters and why certain medicines work. Speaking of medicines, doctors may prescribe different classes of drugs depending on the person. Diuretics help the body shed excess salt and water. ACE inhibitors and ARBs relax blood vessels by affecting hormonal pathways. Calcium channel blockers reduce vessel constriction. Beta blockers slow the heart. These medications are safe and effective for many people, especially when combined with lifestyle changes. But treatment is not only pills. Let's return to Maria and the actionable plan she and her doctor created. First, accurate measurement matters. At-home monitors are useful when used correctly. Sit quietly for 5 minutes. Keep your arms supported at heart level and take multiple readings on different days. Bring readings to your doctor to track patterns. Second, nutrition changes. Reducing processed foods, cutting back on salt, and emphasizing whole foods, vegetables, fruits, whole grains, lean proteins, and healthy fats helps. The DASH diet, short for Dietary Approaches to Stop Hypertension, has strong evidence for lowering blood pressure. Third, movement and fitness. Aim for at least 150 minutes a week of moderate aerobic activity, like brisk walking, cycling, or swimming. Strength training twice a week is also helpful. Exercise improves blood vessel health, aids weight control, and lowers stress. Fourth, manage stress and sleep. Chronic stress can keep your sympathetic nervous system activated, raising pressure. Mindful breathing, gentle yoga, and regular sleep routines lower stress hormones and support healthy blood pressure. Fifth, limit alcohol and quit smoking. Alcohol in excess raises blood pressure, and smoking damages arteries and compounds risk. Sixth, weight management. Losing even 5 to 10% of body weight can meaningfully lower blood pressure for many people. These steps are practical and empowering because they fit into daily life. Now a quick myth check. Myth: I feel fine, so my blood pressure must be fine. False. Only measurement can tell. Myth: salt is the only dietary factor. False. While salt matters, overall diet, weight, and activity also shape pressure. Myth: medicine means I failed. False. Medications help brains, hearts, and kidneys, and are tools to protect your future health alongside lifestyle changes. Back to Maria. She started walking 30 minutes 5 times a week, swapped processed snacks for fruit and nuts, reduced added salt, started a simple nightly breathing practice, and used a home monitor. Her doctor prescribed a low-dose medication initially. Over 3 months, her readings improved significantly and her doctor adjusted therapy. She felt empowered rather than defeated because each step was doable. For folks wanting to get started, here's a simple 30-day plan. Week 1. Get a validated home monitor. Set a daily time for readings and track numbers. Week 2. Add 20 to 30 minutes of brisk walking 5 days a week and increase water and vegetables. Week 3. Reduce processed foods, cook more at home, and try swapping one salty snack for a fresh option. Week 4. Add 2 short strength sessions, practice 5 minutes of breathing daily, and reassess your readings. Make an appointment with your healthcare provider to review results and discuss medication if needed. When to seek urgent care: extremely high readings, systolic above 180 or diastolic above 120, especially with symptoms like chest pain, severe headache, vision changes, or shortness of breath, need immediate medical attention. Remember, prevention matters. Regular checkups, a heart-healthy lifestyle, and listening to your body can prevent many complications. Community support helps too. Invite friends or family to walk, cook, or join you in stress reduction practices. Small social habits are powerful. Let's summarize. High blood pressure often has no symptoms but can cause serious damage over time. It results from a mix of lifestyle and biological factors. Measurement, lifestyle changes, and when needed, medication form the 3 pillars of control. Practical steps include accurate home monitoring, the DASH-style diet, regular exercise, stress and sleep improvement, moderating alcohol, quitting smoking, and managing weight. Stories like Maria's show that consistent small steps create big change. You don't have to overhaul your life overnight. Start with one habit and build from there. Empowerment comes from knowledge, action, and support. If you found this guide helpful, share it with someone who might benefit, and discuss your readings with a healthcare provider. Take one small step today for a healthier tomorrow. Like, share, and follow for more clear health guides you can trust.